Why am I losing hair after hair transplantation?
There is a common misconception that hair transplant surgery is a solution for genetic pattern hair loss. What hair transplant surgery actually does is move hair from the back of the head to areas where there is permanent hair loss. After you have hair transplant surgery, your hair will still continue to progressively thin. Again, hair transplant does not treat hair thinning. This is clearly illustrated when you see a man who looks pluggy or described as having bad plugs. This unfortunate situation often occurs after he continued to lose hair long after the transplant. The phrase losing hair after the transplant can also be applied to shedding that occurs soon after surgery. Shedding is often a combination of transplanted hair from what's commonly referred to as shock loss. In addition, you also often shed native hair, temporarily referred to as telogen effluvium. Something that's not often discussed is that hair shedding that's permanent can occur after hair transplant. This is referred to as collateral hair loss, which means that the trauma of transplant surgery damages a percentage of your existing native hair to the point that the hair is unable to grow. One last but important cause for hair loss after transplant is related to the way the hair is transplanted. The technique that appears to be the most popular in hair transplant surgery currently is called FUE, or follicular unit extraction. This procedure involves cutting out individual hairs with narrow, round-shaped blades. Studies have shown that about 30% of grafts are transplanted without the root of the hair because of the natural angle of the follicle anatomy. This is like moving a plant and cutting off the root. The plant simply can't continue to grow. In addition, it's generally understood that the yield or survival of FUE grafts is lower in comparison to prior methods such as FUT, also known as strip surgery. In 2011, we were trying to improve the hair graft survival for our surgeries using a wound healing material called extracellular matrix by ACell. A year after surgery, we observed that in addition to seeing the hair grafts healing well and growing well, but we also saw that areas of the scalp where hair was not transplanted had more hair coverage. This observation inspired me to explore the possibility of using acellular matrix and PRP in a consistent and predictable way to help people with hair loss without surgery. I eventually developed a system of customized treatments specific to your hair loss profile for men and women, which we call Tricostem hair regeneration. Since 2011, we've helped our patients improve their scalp coverage by reactivating hair that is not growing and thickening hair that's been thinning. Typical results for our patients have sustained for 3 to 5 years or longer with only 1 or 2 treatment sessions that are 18 months apart. Many of our patients who come for consultation are also considering a hair transplant. They come to realize that they can restore a significant area of scalp coverage without surgery and then see if they could benefit from a hair transplant. We also see a lot of people who've recently had hair transplant surgery to help improve their transplanted hair healing and growth. And another group of people we help are people who've had hairs transplanted many years ago. It appears that even transplanted hair can be viable, but is in a prolonged resting stage. Performing Tricostem hair regeneration often results in a significant number of transplanted hair to regrow. This is often a relief, since many of these patients have already had as many hair transplants as they could.